Welcome back to Future Medicine. Today we are looking at Adavosertib, a drug that represents both the premise and the complexity of prison oncology. It's not a household name, but for those fighting certain aggressive cancers, it's a beacon of hope. To help us understand why, I'm joined by two experts. Dr. Rita is a scientist who studied the drug molecule mechanism. Dr. Alana is an oncologist who has administered its clinical trials. Welcome both.
Thank you, Kaiyan. I'm a molecular pharmacologist. My research focuses on the basic science of cancer cell biology. Essentially, I spend all my time in the lab trying to understand exactly how drugs like adavosertib interact with cancer cells at a molecular level.
Hi, thank you as well. I'm a practicing oncologist specializing in gynecologic cancers. My role is the bridge between the lab and the patient. I've been a principal investigator on several clinical trials for adavosertib, so I've been responsible for administering the drug, monitoring its effects, and caring for the patients who volunteer for these studies.
Thank you. And we are also very lucky to join by someone who brings a truly essential perspective to this conversation. Heloise is a patient who took part in clinical trials with adavosertib. Heloise, thank you for being here. Could you please introduce yourself?
Yes, hi, I'm Heloise, and after a few years of my cancer not responding to standard treatments, I looked into clinical trials with Dr. Alana, and now I'm here today.
Adavosertib, a WEE1 kinase inhibitor with a unique mechanism. WEE1 acts as a brake in the cell cycle, pausing division to allow DNA repair. Adavosertib releases that brake, forcing cancer cells with existing DNA damage to divide uncontrollably and die. This drug has been investigated in multiple cancer types, including ovarian cancer, triple-negative breast cancer, and certain lung cancer. Chemically speaking, adavosertib has a molecular weight of 500.6 grams per mol, limited water solubility at 0.0625 milligram per milliliter, and a log P of 3.3, which tells us it's optimally balanced for oral delivery. Its structure consists of 5 rings with 9 hydrogen bond acceptor and 2 donors. Key details that enable the precision targeting of WEE1 kinase. So why do we need to target WEE1 kinase in cancer?
Thanks for asking, Kaiyan. That's a great question.
WEE1 kinase is a key regulator of the G2/M checkpoint in the cell cycle. It phosphorylates and inhibits CDK1, which halts the cell cycle and prevents cells with damaged or unreplicated DNA from entering mitosis. This allows cells to repair the DNA damage before the cell cycle can proceed. Cancer cells commonly have deficient G1 checkpoints, and thus depend on the WEE1-mediated G2/M checkpoint. If WEE1 kinase is inhibited, cancer cells are forced into premature mitosis. This leads to catastrophic levels of DNA damage and cell death, a phenomenon called mitotic catastrophe. Tumor suppressor p53 plays a role in controlling the G1 checkpoint, and when cancer cells are p53 deficient, it makes them especially vulnerable to WEE1 kinase inhibitors. This is a property called synthetic lethality, in which the simultaneous inhibition of 2 genes results in cell death, while the mutation of either gene alone does not.
How does adavosertib actually inhibit WEE1 kinase?
Thanks for asking. I'm more than happy to explain.
Adavosertib is an ATP competitive inhibitor. It mimics the adenine portion of ATP, forming critical hydrogen bonds with the hinge region of WEE1's kinase domain. By occupying the ATP binding pocket, it physically blocks the ATP from binding, thereby inhibiting WEE1's kinase activity.
Adavosertib is being developed by AstraZeneca with collaborations from institutions like the University of Texas MD Anderson Cancer Center and Cancer Research UK.
Our early research focused on its ability to override the G2 checkpoint, selectively driving p53 deficient cancer cells into fatal mitosis.
Great. Now that we've covered the clinical trials, let's talk about how the drugs actually behave in our body. Dr. Alana, can you walk us through the pharmacokinetic of adavosertib?
Yeah, absolutely. So the pharmacokinetics helps us understand how a drug is absorbed, distributed, and cleared from the body over time. This graph shows how adavosertib behaves after a single dose over a 24-hour period. We can see that the drug levels rapidly increase and peak within a few hours, known as the Tmax. After that peak, the concentration gradually decreases as the drug is metabolized and eliminated. This decline is important because it determines how long the drug stays active within the body. For adavosertib, maintaining the right concentration is critical. We want levels high enough to effectively inhibit the WEE1 kinase, forcing cancer cells to divide with the damaged DNA, but not so high that the toxicity becomes too severe for the body. Because of this profile, adavosertib is often given in intermittent dosing cycles rather than continuously. This timing allows us to maximize therapeutic efficacy, meaning the drug is most effective when cancer cells are vulnerable, while also giving the body time to recover between doses. This trial is in the early phase 1, where patients take adavosertib before a planned tumor reductive surgery. This enables researchers to compare tumor biology before versus after exposure to the drug. There are currently 38 participants and 2 groups in the clinical trial today. Treatment is given orally once a day on days 1 through 5 leading up to the surgery. The end goal of the adavosertib is to block cancer cells' ability to repair DNA and survive stress, to stop cancer cells from dividing and eventually lead to death. Phase 1 trial focuses on the mechanism or target engagement and safety. Specifically, primary phase 1 data is currently reviewing changes in DNA copy number, mutations, RNA, or protein expression in p53-related pathways before and after treatment in women with primary advanced high-grade ovarian, fallopian tube, or peritoneal cancer. Key secondary data correlates the drug with pathology endpoints like tumor volume and apoptosis and toxicity in post-op wound healing.
Thanks for explaining. Now let's have a brief commercial break.
Do you or a loved one have fallopian tube, ovarian, or peritoneal carcinoma and are looking for a novel therapy? Talk to your doctor today about joining an ongoing phase 2 clinical trial for adavosertib, a WEE1 kinase inhibitor designed specifically to target these cancers.
Side effects may include, but are not limited to, neutropenia, anemia, thrombocytopenia, sepsis, acute respiratory distress syndrome, decreased white blood cell count, fever, diarrhea, nausea, vomiting, decreased appetite, dehydration, fatigue, hypotension, abdominal pain, mucosal inflammation, pruritus, atrial fibrillation, dyspepsia, peripheral edema, weight loss, weight gain, hypocalcemia, hypokalemia, hyponatremia, arthralgia, anxiety, insomnia, dysuria, productive cough, or back pain. Ask your doctor if adavosertib is right for you.
After years of therapy and no luck, adavosertib has allowed me to return to my daily life again. Now I can keep up with my grandkids and be there for all of life's moments.
Adavosertib represents an important milestone in precision medicine.
It offers a novel therapeutic approach for specific cancer patients and stresses the importance of advancing oncological research.
And now that adavosertib is undergoing early phase 2 trials, we look forward to moving towards phase 3 trials and eventually FDA approval to help patients just like Heloise.
Thanks for spending time with us. See you all next time on Future Medicine.